here to talk with all you guys. And the topic our group are going to share with you today is the health. What kind of health? The health of the mother and the child. Besides it, we are going to focus on especially the areas like the psychological environment related to women, unsafe abortions, postpartum depression, the early death rate of child, and the healthy growth of children. Our group number is 4 girls: Sigrid, Arvo, Akam, Arusan. Now, please everybody allow me to start with a piece of data released by the WTO. In recent years, there are 15,000 of child under the age of 5 that died every day in this world. Besides it, we found the true phenomena which is also striking. Firstly, this early days of childhood rate always happening in the poor areas and nations and areas. Secondly, we compare with Europe and Africa. We found that the probability of child living under the age of 5 is only half of the Europe. Why? Why it happened? There is a very simple question. How to feed a kid is hard? From this page, we can know only the water, food, shelter, second care is enough. But when such simple question become luxurious, why so many kids can't healthily grow? Our group member will give you an answer later detailedly. Now, it is the issue of women. What is woman? Woman is not only the backbone of the society, but also the backbone of her family. However, according to the data we researched before, every year 25 million unsafe abortions occur worldwide. Especially in Asia, 9% of women who have unsafe abortions die for various reasons. I still remember a story which I saw from newspaper. It's a girl who from Kenya. Her name is Maria, and she is only 17 years old, but because of the self-induced abortion unselfly, she ended her life so young. Even if our women will sadly go through the pregnancy, there are still so many struggles in future waiting for us to overcome to contend with. According to the data, there are 15 to 20% of new mothers experiencing the postpartum depression. We found an example of India. In India, 22% of women are suffering from the postpartum depression. However, it's just the superficial figure because there are still so many cases didn't be officially, professionally recorded. Why? Why so many women choose to be silent? Why they choose to hide their feelings? Because of the religious belief, the social and the cultural pressure, and other customs. So now, please allow me to start with the relatively normal perspectives, the unsafe abortion. What is unsafe abortion? According to our group's definition, abortion did by women self or other underground clinic without the medical resources as the support, without the preferential guidance, it is unsafe abortion. There is also data from the World Health Organization. In this world, every year, 73 million induced abortions each year, and in these, 45 of them are unsafe. And in these 45 parts, 13% of them are kills the immediate deaths of women. Besides the immediate deaths, there are also other outcomes to bring. Several infections, massive hemorrhage, and organ damage, lifelong pain. There are approximately 9 million of women they are suffering lifelong pain of these factors. Now please us to focus on the differences between the typical nations. Firstly, Africa. As we can clearly see from here, Africa is the largest continent where has the highest percentage of the unsafe abortion occur, especially in Kenya. Kenya government has led the listed the unsafe abortion as the third reason of leading women to die today. Secondly, it is the Asia. Asia, the unsafe abortion also still be a serious problem of causing the Asian women go to die. Like especially in India. Like India, even the abortion is legal, but there are still so many shortages and disadvantages of their medical resources and system. Thirdly, Latin America. In Latin America, a lot of places the abortion is criminalized. So the women here, they are only connected to homicide have the abortion. In Argentina, every year, 500,000 per cases, they are doing this abortion unsafely and professionally. Last one is United States. Obviously, we can clearly see the comprehension of the differences between among other places. It is the lowest possibility of having an unsafe abortion. What's the reason? We are also curious. Firstly, strict legal restrictions and policy obstacles. According to the statistics we collected before, there are still 24 countries in this world that totally ban the abortion. So it pushes the women. They have to find the underground clinics and doing the abortions by themselves using the dangerous ways. Secondly, economic poverty and lack of medical resources. Because of the high cost and the sickness of the medical system of the society, women have to force to using the dangerous ways like the close holster, poison to kill their baby. Thirdly, deep-rooted social and cultural pressures. Because of the incorrect and conflictively sex education, women they are ashamed for words. Shameful admit they have the requirements normally of their body. They are ashamed to admit they want to kill their kids, even just removed from their own body. How to solve the problem? From our group, we conclusion like, firstly, law is the foundation. We must help the government to push the abolish all the restrictions and to simplify all the steps, return the right of abortion to women. Secondly, equal medical resources, it is the support. We should help the poor areas to improve the coverage of the hospital and help them to training the professional staffs. Thirdly, cultural change also it is an opportunity. We should have the completely correct sex age, and like women, they are never ever ashamed to admit they have the requirements culturally, naturally. As the Hillary Clinton said, women's right is human's right, and the human's right is to choose or to choose. This is my part, and let's welcome my next partner.
Hello everyone, I'm Maru, and today I'm going to talk about something unnoticed but affects millions of families around the world. It's about maternal health after childbirth. When we talk about childbirth, we often celebrate the arrival of a new baby, and rightly so. But what about the mothers? Because after giving birth, mother's body and mind goes through intense changes. Many women face with a serious risks such as infection, depression, high blood pressure, and even death. And this time is called as postpartum period. It's not only a time of joy, but also one of a vulnerability. In fact, according to the World Health Organization, over 800 women die per day from preventable causes related to pregnancy and childbirth, and most of them in low-income countries. Even in wealthy nations, women can suffer in silence due to lack of mental support or inadequate follow-up care. And how you understand? Today I will share with the common issues that women face after giving birth. These problems include physical health, mental and emotional issues, also social challenges. And we'll start from the physical issues, from postpartum hemorrhage. What is it? Postpartum hemorrhage is when woman bleeds heavily after giving birth. Usually it's more than 500 milligrams of blood. It happens when uterus doesn't contract properly. Why is it dangerous? It can cause shock and death, leading to maternal death in the low-income countries. And we can see this problem in areas such as India, Ethiopia, Nigeria, and Bangladesh. Next, infection. Infection is bacterial of uterus and birth canal after delivery. It happens due to poor hygiene. Why it's dangerous? If untreated, it can cause pain, fever, and even death. And we can see the problem in areas of Afghanistan, South Sudan, and Pakistan. And how can we solve the postpartum hemorrhage? We can solve postpartum hemorrhage with better emergency care and skilled birth attendants. Because with skilled, trained doctors, midwives, who can stop deeply bleeding, and also they can give right medicine. With this solution, we can save the millions of mothers' lives. For infection, I can ensure clean birth practices because this problem is due to poor hygiene, and with clean environments, we can provide immediate treatment to prevent infection from spreading. Next problem is a postpartum depression. It's a serious emotional risk that every woman faces after giving birth. It can cause anxiety, stress, hopelessness, and cause loss of interest in a baby. This kind of problem can lead to suicide or neglect of women. We can say the problem globally around 10-13% of mothers who are affected. And main solution for depression, it will be integrate mental health screening into mothers. Because before leaving the hospital, we should screen for depression every mother, and again following the visits. This kind of solution with early detection will help receive counseling and treatment right away. And the last one is social challenges. Every woman can feel unsupported, overwhelmed, especially if their partner or family doesn't give enough support and enough help with childcare. This problem can increase stress, can risk of depression, and we can see this problem in rural areas and urban areas in developing countries. How we reduce the social challenges? For this, I can share build community support programs for new mothers. Local centers and local organizations can make this program to help women feel unsupported. And this will help to reduce stress and give practical help with childcare. Thank you for listening. Let me introduce our next presenter, Ayhan.
Good afternoon, everyone. My name is Ayhan, and I'm very grateful to be here. Today, I want to talk about a serious global health problem, the poor health of children after birth, especially due to malnutrition and other preventable diseases. In 2023, about 4.8 million children under the age of 5 died. Half of these deaths happened in the first months after birth. That's over 2 million children who didn't get a chance to live. The most affected areas are Sub-Saharan Africa and Southern Asia. Countries like Afghanistan, Somalia, and the Central African Republic have the highest infant death rates. So, these deaths are often caused by malnutrition, dirty water and poor hygiene, also living in war zones. Why malnutrition is dangerous? Malnutrition is when the child doesn't get the right amount of food or nutrition. It weakens the immune system, making babies more likely to die from simple infections like pneumonia or diarrhea.
just the body. It also slows down the brain's development. So, now let's look at the powerful, real solutions that can save millions of lives. First one, national nutrition programs. Government should create programs to give healthy food to pregnant women, also children. The great example of that is Poshan Indian program. Poshan Indian program was created to reduce the malnutrition, child malnutrition. Skilled birth attendants. Every baby should be delivered with trained nurse or doctor. That will reduce the problem while giving birth, and they save newborns. Free vaccinations for all children. Vaccines will protect against deadly diseases like measles or diarrhea or pneumonia. According to UNICEF, vaccines save up 3 million lives each year. Educating mothers. When mothers learn about breastfeeding, hygiene, baby care, their baby is more likely to live. And the study shows that educated mothers save lives. Clean water and sanitization. Dirty water, diarrhea caused by dirty water, kills babies. Government should create clean water systems and the toilets in her areas. And then the next one is working with NGOs. Government should work with organizations like UNICEF to save children, to help them, to get right amount of food, training, and the medical tools. Emergency help in war zones. In conflict areas, we must send medical tools, trained doctors immediately. In that areas, babies in a high risk of dying. All of these solutions are possible. We have the knowledge, tools, and the people. What we need is action, care, and investment. By giving children proper food, clean water, trained doctors, and vaccines, we can save millions of lives. Let's not forget, every baby matters. Every child deserves a chance to play, grow, and live. Thank you for listening. Let's continue.
So, hello everyone. My name is Aruzhan, and thank you for hearing today. So, I want to start with the next problem. Is the lack of access of prenatal health. So, I would like to talk about the prenatal health. It's the everyone which we have effect for the nowadays. So nowadays, as we can know, the life we start with the pregnancy, and how we just take care for the pregnancy woman is huge, intense for the not only for the mother and the child. It also impact for the families, communities, and of course the countries. So and sadly, for the nowadays, the pregnancy effect have not supported with the good medical activities, like some kind of checks up, vaccines, and etc. So, why prenatal care matters? So, the prenatal care matters is provide the prevention and the preparation. It means that every month, the pregnancy woman has to go for the checks up, have some vaccines, and have some advice from the doctors and go to see the doctor. So, the early intervention complications, the true nutrition supplements reduce the risk prevention birth of the low weight. So, the prenatal care helps for each woman to have good support for the doctors and their families and the country. So the problem, if we just talk about the problems, we have some skills. So millions of the pregnancy women are worldwide, especially of the rural or low income areas, don't get the good care of their health. So, for example, some women have no no time for the doctors to see, or maybe they have some kind of places where there's no transportation or etc. No one have no time for to take off their work because no one has to watch their other babies and etc. For this, if the women are not take care for other health, it can become for the children, and the children can birth with some kind of issues. For this, I want to show some kind of countries have some kind of problems. The first one is India. India has some problem with no nearly clinic. What does it mean? We have some solution for this. It's mobile health clinic remote areas. So what does it mean? In the mobile health clinic have some vans which is done for the villages with the doctors, and the doctors can help for the pregnancy women to take care for them. Next one is the Kenya. Kenya has some problem with a high medical cost. For this, we have some solutions. The government and the NGOs can help with them with a free and sometimes checks out environment funding, because nowadays, as we can know, the prenatal care are so expensive. Next one is Bangladesh. So Bangladesh have no transportation. As we can know, the pregnancy woman is hard to walk, and if there is no transportation, they have some problem with their health and the baby. For this, we have some solution. The local health post in touristic units. What does it mean? It means that in the local areas, the doctors help for the women and they train them for the take care of the women. They have some trains like how to take care of the baby, how they vaccines all them, or some kind of giving the advices, and of course psychological trainings like mental health. If they have some mental health issues, they can talk with them and of course solve their problem. So we have some impact and additional benefits. So as we can know, the prenatal health, they have some kind of benefits like the stronger families of the communities, empowering informed women, and etc. If we have if we just listen all of the solution which I just told, the babies which are born the healthier, then they stay after the school and they have a better future in their life. And of course, if the prenatal care helps when the doctors, when the mothers, the women, girls who are pregnant go to the doctors, and the doctors can give some kind of advices. For example, what to eat, how to avoid some kind of issues, and some of them give some advice what kind of vaccines or catch some kind of problems like the diabetes, the high blood pressure, and the etc. Yeah. For the final issue, the final thought, I want to say that the lack of the prenatal care is serious but solves the problem. And even every mother deserves the safe pregnancy, and every child deserves a healthy start in. And if we just all of them thought about all of the solutions which I thought, we can show that the prenatal care is not some kind of luxury thing. It's just a simply human right. So, in conclusion, I want to say that the women have some kind of issues like malnutrition, some kind of lack of the prenatal cares, abortion, and some kind of postpartum issues, which if we cannot solve, it can be the most lack of issues in the future, because if the children every children wants to birth a healthy lifestyle in the future, and the mother of course wants for them.
The solution is clear. Healthcare must be not as a luxury, but as a basic human right. Every woman, every child, in every corner of the world deserve to live a healthy life. So let us stand together to make this vision a reality. Thank you for listening.
guys, we're gonna continue with the next group. Okay, let's have the Q&A next week.